So data does make a difference. In PCORnet, just to give you an idea, kind of really briefly what it is, it's a national infrastructure set up by the Patient-Centered Outcomes Institute that wanted to bring together big medical institutions with electronic medical records, and then some groups like ours who are patient-powered. And they wanted to form this network that would enable research to be done faster and cheaper. So we are one of the 20 patient-powered research networks, and some of the PPRNs are focused on rare disease like us, and some are common diseases. The clinical research, data research networks, which are the large medical institutions, are usually several different hospital systems put together. So, for instance, one of the big CDRNs is called PedsNet, and it's a lot of the pediatric hospitals around the country. And altogether, that forms PCORnet. And as part of our PCORnet project, we have family advisors that guide us. We meet on a monthly basis. This was our photo from last year's meeting, our face-to-face meeting here at the Connect conference. And they help us figure out who is going to have access to our data, what's the policies around that, what kind of language do we use when we put out information. They help us when we're picking out questionnaires to add to the registry. They help us and guide us with that kind of information. So they are an incredibly valuable resource to us. We could not do it without them. So I wanted to point out, we just launched this week the Duchenne Connect PCORnet page, so information about our PCORnet project. And you can go to Duchenne Connect and pull down the PCORnet tab, which is underneath the Home tab, and find out more information. And at the bottom of this page, I couldn't fit it all on the slide, we actually have introductions to each advisor. So you can read a little bio about each of our advisors, which is great. And then we also have a research projects is on there as one of the tabs that you can look at. So you can look at some of the upcoming projects we have. Right there. And so the other interesting thing that we're just launching is kind of part of our whole PCORnet infrastructure stuff to make the registry better for you guys and for researchers in general, is that we have now a way, we're launching it this weekend, we're very excited, to allow you, people who are in Duchenne Connect, to connect your patient portal to Duchenne Connect. If you're seeing at multiple hospital systems, you can go to multiple hospital systems and connect those hospital systems. And we'll bring that data in to your Duchenne Connect account. So that will allow us to have things, right now it may be a little bit on a limited basis because a lot of hospital systems, their patient portals aren't quite as robust as far as what they offer you to see, but usually there's things like medication list, surgery list, problem list. Sometimes there's clinic notes in there, so we hope over time we're going to get more information and valuable for researchers and clinicians and for you. It's a great place to go one spot for all your medical records. This is an actual screenshot of what that's going to look like. So when you go through the process, we're actually asking people to come to our table and we'll sit down with you and go through the process with you this week if you would like. You actually get to choose by an electronic way your medical system, and it will do the connection with you step by step. So this is our website. We are on Facebook, Twitter, and Instagram too. That's our other account that we're on, so please follow us. And I'm going to introduce Rebecca Wilcox. Rebecca is with OneFlorida, and OneFlorida is one of those really big medical CDRNs that we're a part of. And the great thing about OneFlorida is to be a CDRN in PCORnet, one of the things that you had to do was choose a rare disease to focus on. And OneFlorida, which is great, we're in Florida, chose Duchenne. So we're very excited to partner with them, and Rebecca's going to tell us a little bit about some of our collaboration.
Yeah. Thank you very much for the opportunity to be here to speak a bit about OneFlorida. As Anne said, it's a clinical data research network funded by PCORnet, and we've worked at the University of Florida very happily with PPMD for many years. So when we did need to choose a rare disease focus, it was really important to us that that focus was Duchenne. The OneFlorida network is really a network designed to facilitate patient-centered research in Florida. And what we hope to facilitate is an infrastructure for a variety of different research projects. So we hope to facilitate the inclusion of a wide variety of people, a diverse cohort in research. We'd like to do comparative effectiveness work, and I'll talk a bit about the first project that we're planning and starting up around comparative effectiveness work in Duchenne in a moment. We hope to build an infrastructure for pragmatic clinical trials, and as part of that, we have developed a centralized IRB so that across our network, trials can be approved in one institutional review board. Finally, we hope to facilitate implementation science. So once the research draws some conclusions about what care may be more effective, we hope that our research will help get that into a variety of clinics beyond just the certified Duchenne care centers, which is an incredible effort, into less served communities. The OneFlorida network is a big network. As you can see at the bottom of the slide, when it's fully up and running, the network will include about 10 million patients, more than 4,000 providers, and a wide range of care settings, hospitals, and practices. So what we hope is that all of those data will be brought together into a data trust, and that's really a key part of the OneFlorida network. We hope we'll take Medicaid and Medicare data, vital statistics data, electronic health record data, as Anne talked about, and research data like patient-reported outcome data and registry data, and bring it together in one place so that when a researcher is looking to answer a question, there's a place they can go to get access to data that already exists to try to answer that question. Now, the kinds of questions we are asking really depend on you, the community. Because it's PCORI funded and because it's patient-centered, it's really important to us that we're doing work that matters to the patients. And that's where we're really excited to partner with Duchenne Connect. We hope that through them, your input will drive the research process, and through them, you as a community will tell us what the important questions are. We don't want to go after what's important to us, we want to go after what's important to you. We also hope that we'll be able to do collaborative studies with Duchenne Connect, so that both the design and the implementation of the studies are working together with this great organization. The first study that Duchenne Connect brought to us that they told us is important and that we believe is important is around bone care. We hope that we can use this data trust and this network to understand what kind of care people with Duchenne are currently receiving for their bones and what kind of tests we're currently using. And then hopefully we can do comparative effectiveness research to ask what tests and treatments are most effective, which tests are predictive of fracture risk, and which treatments are maybe more effective at postponing or reducing fracture risk. To do that, though, we need to be able to identify people with Duchenne based on their medical records alone, which isn't as straightforward as we might have hoped. So our first step is to develop a computable phenotype, or a set of characteristics that you'd find in a medical record that tell us that that medical record belongs to a patient with Duchenne. We hope that once we have that computable phenotype built, there's a lot of questions that we can answer using those data, using this data source that already exists, that doesn't require more input and more commitment from the community. Where we do need help from the community, though, is to understand what's important and what we should be investigating. And we welcome input both through Duchenne Connect and through the PPMD team, and directly. I'll be at the meeting the whole time, and I'm delighted to talk in person. I have a poster tomorrow to hear what's important to you within this electronic health record data. Thanks again for the opportunity to speak.